here and help field questions.
That sounds great. So I'll have Jen kind of kick off the meeting. She'll just do a quick kind of coming events calendar, and then she'll hand it over to me. And I'll introduce you guys, and then we can run from there. Okay.
Is it better on that? Hold on, I'm just gonna check the lighting. Okay.
I'll just turn it over.
Yeah, I think that's
Is that
better.
better?
Yeah.
Perfect. Hi, everyone. So welcome to Grand Rounds. Very excited to kick off what is kind of the first official one. We're bringing on some amazing practitioners, and I know as we move through the next ongoing months in Grand Rounds, we're really excited for all that's to come. So as Tom alluded to, I'm going to hand it back to him in a second. Following this specific Grand Round session, we're going to be sending out a series of questions, which is essentially going to be how we're verifying your presence and being able to get this CME approved and eligible. So you can look for the recording from this hour and then also a few questions that we're just going to ask you to fill out after that. Additionally, we'll provide some information from CrossFit HQ as to how to actually get your CME approved and get that back to you. And so again, we'll follow up with some additional details once we get rolling in August when the on-demand journal articles also drop as well in that month. Just a couple of reminders. The next newsletter is going to be out the first Monday of August, which I believe is August 5th. We'll have Grand Rounds the third week in August as well, that third Thursday. And then we're also going to be at the games, which is kind of sandwiched in between the newsletter and Grand Rounds next month. And there's some exciting stuff going on there in terms of, times that we're going to be together for a workout. We have some panel discussions lined up. We'll be at the EDU booth and really just trying to connect with healthcare providers that are going to be at the games and, try to rally the troops here and keep things moving. I'm going to give it to Tom. One more thing, just real quick. I'm going to be monitoring the chat. So as you guys have questions, go ahead and drop them in there. And then as appropriately kind of the way that the presentation is going to work, we'll be able to address some questions, if not during, for sure at the end. And I'm really looking forward to this. Okay, I'm going to mute myself now. Tom, you're up.
Awesome. Thank you, Jen. Thank you, everybody, for coming, and thanks for being flexible with the timing. I'm sure that caught a few people off guard. We had clinical responsibilities that could not be changed, so I know you guys all understand that and appreciate the flexibility. It will be recorded, so those folks who couldn't make the time adjustment will be able to view this in its entirety and still get the CME credit. But I would like to welcome two very good friends of mine I've known for quite some time, Doctors Dinesh and Shweta Raju. If you saw the July newsletter, they wrote the feature piece for us, and there was a highlight, provider spotlight on them as well. So you could certainly learn more about them and their background in that piece. But they're going to be talking to us extensively today about the work that they're doing in their affiliate to bridge the gap. And we're so excited that they have one of their patients here with them, actually, Mr. Rippey, who's going to be joining us for part of the webinar today to talk about his experience and highlight some of the work that he's been doing with Shweta and Dinesh, utilizing CrossFit as a tool here and a treatment strategy. So without too much further ado, I will introduce Shweta, MDL2, double-boarded physician as well as an MBA, and Dinesh, who's also double-boarded in neurology and sleep medicine, I believe, to take the lead here and walk us through their presentation. Go ahead, guys.
Awesome. Are you okay to hear me? Looks good. Okay. Good evening, everyone. Thanks so much for joining us today in this inaugural CrossFit Medical Society Grand Rounds. Before I get started, I just wanted to make sure we introduce Mr. Brent Rippey, who's our patient and probably the highlight of this whole presentation. And he'll be at the end. But I also wanted to introduce Dr. Shweta Raju, who is pivotal in developing our healthy wellness and healthy living program at our clinic, and also Eddie. And I'm not going to mispronounce Eddie's last name, but Eddie will introduce himself in a few moments. But Eddie has been an integral part of our team as well. Eddie is a veteran in CrossFit, beginning as L1 in 2009 in at the ranch, and has been active in both the competitive field and also in coaching for the last almost 15 years. And he's been a huge part of our program in developing the physical fitness component for the Healthy Living program. What we wanted to focus on today is talking a little bit about CrossFit and how it's meaningful, not just as a modality for fitness, but also how we can translate that into the clinical venue. And
Can we just double check if they can
yeah,
start?
are you guys able to see my slide? It says Our Journey Tonight. Are we on that page? Okay, great. So we're going to focus on the Tabata, and actually the initial Tabata paper that started to become the foundation for much of the CrossFit journey. Once we're done, I'm going to transition that to Shweta, and she's going to talk a little bit more about the physiological impacts of high intensity interval training. And she's going to talk a little bit more after that about the CDC exercise recommendations and how we actually incorporate that within CrossFit already without even thinking about it from the CDC's perspective. She'll then review some of the components of CrossFit, and then we'll spend a lot of our time with Mr. Rippey, who is a wonderful person and who's been through a lot in the last few months from his journey in CrossFit. But what we want to leave with is the takeaway, which is CrossFit's multimodal approach can improve multiple health metrics and move an individual from sickness to wellness and ultimately to fitness. And the way we want to show that is by introducing how a component of CrossFit can be extrapolated across the board to multiple modalities of fitness. To do that, I would like to talk about Tabata. Now, we oftentimes use the Tabata exercise in our CrossFit introductions, for example, in a warm-up or in a workout, and we talk about the 20 seconds on and 10 seconds off. But we sometimes don't really think about why is that such an important detail. And what I wanted to share with you is the initial Tabata paper, which set the foundation for why Tabata is good. The history of interval exercise training began in the 1930s with endurance athletes, and found that endurance athletes were able to do high intensity interval training to help them maintain their endurance. But when we started looking more carefully about what more can high intensity interval training do, Tabata was the first one to explain that not only does it improve your aerobic capacity, it also improves your anaerobic capacity. So think about that for a minute. Within CrossFit, when we look at the L1 or L2, or if many of you who've been through biochemistry, we know about the phosphagen system, which is clean for 10 seconds. We know about the anaerobic system, which is great for about 2 to 5 minutes. And then we have the aerobic, which has a lower output of power, but can be maintained for much time. But with high intensity interval training, it goes even further. So the paper I'd like to take a look at is the effects of moderate intensity endurance and high intensity intermittent training on anaerobic capacity in VO2 max. You know, we talk a lot about VO2 max, but in very simple terms, VO2 max is a volume, which is the V, of oxygen that an individual can consume during an active process, usually some kind of fitness. But most of the time, it's in running or bicycling, which is the metric. So you'll actually see down in the photograph on the top is one of the original VO2 max machines going through ultimately a mass spectrometer. So if anyone did chemistry in the 1980s or 1970s, you'll actually see the old mass spec that's on there. But down here, you're going to see a more advanced system with a bike, which is a pedaled bike, but also with a brake. So you can actually adjust the pressure and the resistance rather than just biking as fast as you can. So the question that Tabata asked is, what is the impact of oxygen uptake when performing moderate intensity exercise versus high intensity exercise? Now, one of the limits is that the VO2 max is simply one metric of fitness. But I want to put that aside. I don't want to really emphasize the weaknesses per se of why VO2 max is good or bad, but I want to highlight the point that high intensity interval training offers something more than just steady state cardiovascular fitness. I'm going to show you a very brief clip of how VO2 max can go beyond just the bicycle and the treadmill. This is Dr. Julie Fouché, who was a very well-established CrossFit athlete in the early 2012, 2013, 2014, and is now a practicing physician. And I just want to play a very brief clip. And are you able to see the YouTube clip right now? Okay, it won't be long. It's about 10 to 15 seconds. I just wanted to show you that clip because that is a newer system of VO2 max measurement that can be used even within our CrossFit community. One of the big downfalls of the old VO2 systems was that you were tethered to a machine, but now you have a portable system that you can measure not just cardiovascular fitness, but also actual weightlifting as well. And the reason I wanted to show you this is that there is some great information coming out within sports physiology that looks at fitness and VO2 max beyond just the running aspect or just the endurance aspect. Let's go back to the Tabata paper. So what Tabata did with his group is he took a total of 14 young men. These are all master's level bachelor's students within Japan, and they were all in varsity level sports. Now, I'm not sure if you call table tennis varsity level, but one of them was a table tennis player. There was swimming, there was soccer, and I think volleyball was one of the sports. Well, the bottom line is all these gentlemen, all men, were about 23 years old. Height was very comparable and weight was very comparable. And their VO2 max was also relatively comparable. And what he did was he broke them down into two different groups. If you look on the left-hand column, there's experiment 1. These 7 men did 60-minute workouts 5 days a week for 6 straight weeks. And each of them was able to reach their VO2 max at 70% of their VO2 max during the workout. And how they did that was that, remember, it's a bike with a brake on it. So they were trying to reach 70 RPM per person, but with a different amount of resistance. So everyone was getting the same amount of VO2 max for their individual limit. Each subject had their VO2 max increase each week, as we would kind of anticipate, but then the workouts were adjusted with more resistance on the bike to accommodate for that new 70% max. So they were constantly improving with each passing week. And then during the training, what they also looked at was called the maximal accumulated oxygen deficit. Now, let me explain that more conceptually. We won't have time to go through the metrics of how to do that. But when you are, for example, doing Fran, and you have a certain amount of oxygen that you need as an individual to finish the Fran workout. But what happens is that when you consume oxygen, you're using that through the through the aerobic system, through the mitochondria to generate ATP. But what if that's not enough? And it's not. You need more ATP to finish that workout. Well, that's when the anaerobic system starts to come into play and supports the aerobic system. So even though we talk about the phosphagen and then the glycolytic pathway and the anaerobic, they don't shut down. They're always working, but at different amounts. And so what they're measuring is the maximal accumulated oxygen deficit is how much more do you need once your aerobic system is tapped out. And that's what they're measuring. Now, the VO2 max was determined before and during every week in that particular training period. But let's look at experiment number 2. This is the other 7 gentlemen. 5 days a week, again, for 6 weeks. They worked out for 4 days a week with more of an intensity training protocol, 7 sets of max duration, max effort on that bike. So they were just revving it as hard as they could. But as soon as they dropped below 85 reps per minute, poof, that interval was over. They took a break and then they went back in again. Again, their VO2 maxes were measured, but to give them a little bit of a break, they spent 1 day doing a 30-minute steady state VO2 workout, and then 4 sets of max effort, but not as intense as those first 4 days. Again, their anaerobic capacity was determined, and their VO2 maxes were determined at unique intervals. Now, this slide is what sets the Tabata apart. And I'm going to walk you through it. On the left-hand side, on the y-axis, you see what's called the anaerobic capacity, which is measured in milliliters per kilogram of weight. On the x-axis, you're looking at the duration. The dark line is the interval training, which is experiment 2, and the dashed line is the endurance, the continuous training periods. And what you notice with this each passing week, the interval training, their anaerobic capacity goes up. In very simple terms, what this study was showing was that if you measured the oxygen deficit, means how much more do you need beyond the simple aerobic system, patients, it's not patients, forgive me, kind of habit there, athletes who were doing the interval system found a greater kind of tank to use their anaerobic system to support their aerobic system. So in the interval training from week 0 to week 6, they saw a huge jump. But even from week 4 to week 6, they saw a big jump. But the endurance training folks, they stayed pretty flat throughout the whole period. That's what sets apart the interval training system from a straight straight moderate intensity training. And this slide is what shows that it doesn't really matter if you're doing high intensity or moderate intensity, you will improve. Fitness measured as a metric of VO2 max does improve irrespective of the type of exercise that you're doing. But what sets the interval training apart is that it helps develop this extra metabolic pathway that can compensate when your aerobic system starts to fatigue out. And so the take-home messages from the Tabata experience was that moderate and high intensity groups both experienced an improvement in their VO2 max. And just to go back to show you this again, on the y-axis, we have the maximal oxygen uptake, which is a VO2 max, and then we have the training duration. And with each passing week, there is an improvement. And when you see the double stars, the p-value is thought to be significant, but both show an improvement. But what sets apart the high intensity group is that they also had an improvement in the anaerobic capacity, whereas the moderate intensity group did not experience any significant change in their anaerobic capacity. Now, there are some caveats to the study. Sample size is very small, and you need a lot more, but also this study only focused on the bike. There's so many other modalities for fitness. But why this matters is that it suggests that high intensity interval training develops not just your overall ability to consume oxygen, but also helps you boost a second metabolic pathway that can help promote and maintain your fitness in different types of exercise domains. So that's the general idea. I want to transition a little bit before Shweta takes over. And I wanted to make the comment that high intensity interval training was really started to be published in 1930. But if we look at PubMed and all its publications, if you take a look here, the science of high intensity interval training has been increasing dramatically from the year 2000 now all the way to year 2020 when this article, this review article was published. So this is a very interesting topic, but the thing I want to leave you with before I hand it over to Shweta is that what the Tabata paper shows is that at least with endurance, I can do more with high intensity interval training. The extension of CrossFit is that now you have other components, which is the weightlifting, which affects different metabolic pathways and also different health metrics. For example, osteoporosis, which I think may be a topic in the near future that we'll be covering. So I'm going to pause there, and I'm going to shift to Shweta, who's going to take over and talk a little bit more about CrossFit's impact in the grander scheme of health.
Thanks, Nash. Okay, so I think as Dinesh mentioned, there's been an explosion of research on the physiologic side that supports the methodology that we utilize in our training in CrossFit. And so the challenge that we face now that we have this data is how do we implement it? How do we actually deliver all the benefits to our patients? The 99.5% of the population that's not doing this type of training consistently or in a way that they can maintain and progress with. And this review paper that we have just mentioned shows, all the different benefits that have been outlined due to this type of training methodology. So not just improving VO2 max, but I'm just going to quickly review these other benefits. On the psychological side, improves mood and decreases feelings of depression and anxiety. Lowers the risk of cancers, including breast cancer. Lowers the risk of cardiovascular disease. Improves metabolic rate and lowers body fat mass. Reduction in osteoporosis as well as osteoarthritis. Helps people who are suffering from arthritis-related pain or other types of pain have been shown to have decreased experiences of that pain sensation. And then along with the breast cancer, also lowering the risk of colon cancer, and then not only just reducing falls for older people, but the complications that come from those falls. So I think, especially over the last 5 years, it sometimes seems our government recommendations are not always in line with what we're experiencing on the ground. But in the case of exercise, what we're recommending and what the CDC recommends is actually quite aligned. And this was published by the CDC back in 2019. It's the most recent update that's come out in terms of the public health recommendations for exercise for adults. So just to summarize, what they say is that adults should be moving more and sitting less throughout the day. And just starting with sort of the point that some activity is definitely better than no activity. I don't think any of us would disagree with that. But for health benefits, adults should do at least 150 minutes per week to 300 minutes of moderate intensity exercise, or 75 minutes to 150 minutes a week of vigorous intensity aerobic physical activity. And then they go further to explain that moderate intensity is where your heart rate is up, but you can still have a conversation. But during vigorous intensity, you should not be able to have a conversation for that period of time. Or you can do a combination of moderate and vigorous intensity aerobic exercise. The CDC will approve that as well. They do say, it's probably not best to do that all those 300 minutes in one day a week, although again, that's still better than not doing anything at all. But if you can spread it out, maybe, 3 to 4 1-hour sessions during the week, that would be ideal. And, I think it's also interesting that they do make a point to say, you don't have to stop at 300 minutes. If you're an adult who's healthy and looking to maintain your health, it's absolutely appropriate to do more than the minimal recommended amount. And they also mention that adults should do muscle strengthening activities of moderate or greater intensity that involve all major muscle groups on 2 or more days a week, as that also provides additional health benefits beyond just the cardiovascular and interval training. So I'd now like to take some time to just re-emphasize how aligned not only this recommendation, but what we provide in a CrossFit gym is with allowing people to access this level of training for their own personal health. And if you've taken the L1 or kept up with CrossFit literature, I'm sure you've seen the sickness, wellness, fitness continuum. And so what we're talking about is not just moving people from sickness to wellness, but also moving them towards fitness, which is, as outlined in the original paper, our best hedge against, future sickness. And as you can see, a lot of the same measurements that we use for wellness are the same benefits that we can derive from the high intensity interval training. when we review the hundreds of studies that show its benefit. And I know not everyone in the CrossFit Medical Society has taken the L1 or other educational courses. So I did want to just, briefly outline again, what is it that CrossFit coaches and CrossFit affiliates are looking to offer to our members and athletes? What are those physical skills? Cardiovascular respiratory endurance, stamina, strength, flexibility, power, speed, coordination, agility, balance, and accuracy. And so this kind of brings me to my summary point about, how can we succinctly explain to our patients why they would want to pursue CrossFit training for their health? Not just only for a specific sport, but why is it important for general health, for moving from sickness to wellness to fitness? Because with all these 10 physical skills, what we're providing to our patients is general physical preparedness, GPP. And that is really the root of the way programming is structured. And I'll show a few slides from the L1 related to that. But it's training designed to provide balanced physical conditioning in endurance, strength, speed, flexibility, and other basic factors of fitness. And this is really in contrast with specific physical preparedness, which concentrates on exercises which are more specific to the particular sport. And there was a good paper that came out on CrossFit.com, GPP, what it is, why you need it, and why CrossFit is the best way to get it. And so I would say if you're in the healthcare space and again, looking for the right language and the way to sort of explain these things to your patients and colleagues, that is a really good paper to take a look at. So we've already sort of reviewed the Tabata, and then we're familiar in our training with the other types of high intensity interval training that we do, like AMRAPs, EMOMs, rounds for time. All of these are variations on the theme. And in the L1, we also teach coaches, how is it that you can explain these types of stimulus to your athletes? And so the education that's provided during the L1 and in the L1 materials, again, really aligns very well with explaining this to our patients and helping them understand how they can also achieve the same benefits, even if they look at what's written on the board and think, oh, I can't do this. And I'm not going to get too much into the details of this because I really want to save a lot of time for question and answer and discussion. But again, this programming structure, which is what traditional programming structure is in most CrossFit affiliates, where we use like metabolic conditioning on week 1, day 1, then gymnastics and weightlifting on week 1, day 2, and then maybe a combination of all 3 modalities on day 3, et cetera, et cetera. Again, it goes right back into GPP, which goes right back into what is recommended for adults to stay healthy and active. So now I'm getting to my favorite part of this presentation, which is to introduce Mr. Brent Rippey. He's a great friend, and I don't think he would mind me saying he was the 5th grade teacher for both of our children. So we have a relationship that sort of spans many different domains in life. Then came to be my patient after that, and then most recently has become a friend in our gym. So just to give a little bit of background, he did a trial class with us about a little over 3 months ago. And then in our affiliate at Madmere, we do a foundations program, which is 4 personal training classes. And it was an absolute pleasure for me to get to do that with him. So we spent those 4 hours together, and I had a chance to introduce him to all the basics about CrossFit. And then after that, he joined at our 3 days a week level, which was really what worked best with his teacher schedule and, all that was going on towards the end of the school year. But he was very consistent about coming in 3 days a week. This past June, he joined our gym-wide fitness and nutrition challenge, which I think was a really great kind of acceleration for his progress. And right now, like at this present point in time, he has lost 10 pounds, which is really like the least of my celebrations for him. But he's off both the medications that he was taking, and everything is really moving in an amazing direction with all of his metabolic markers. So, this is sort of the way we would talk about you, Mr. Rippey, at a medical conference. But 52 does have a history of a little bit of acid reflux. And so he had just very recently had those like borderline blood pressure numbers, as you can see, like February. This was like all right before we invited him and he joined the gym. And so both the blood pressure and the cholesterol is like basically solved with his current training and exercise and diet regimen. So I wanted to sort of pause there, and we did sort of discuss some questions that I was going to present, but I don't know, Jen, if you have anything in the chat that you want us to start with.
So far, there's no questions, so you keep cruising.
Okay. All right, great. So my first question, and I wanted to sort of bring Eddie into it as well, because, he's been part of helping train Mr. Rippey in the gym, and like several other patients who have been sort of following a similar story. So my first question was, just tell us about your experience since you joined, and just kind of, I'm gonna leave it open there.
Okay. Well, thank you for having me, and same, just a dear friend and just a wonderful doctor's practice, and I appreciate all the support, and I just felt like loved from the point of just being cared for by your team. So I appreciate that very much. And I guess there's some words that kind of jump out to me that kind of sum it up, is that I feel it's positive. The CrossFit the experience has been very positive, organized. There's definitely structure in it, which is something from dabbling with it years back that wasn't there. The support, the hard work, and also surprisingly the fun that goes along with it. And so, for example, from the minute I walk in the gym, there's a feeling of like, I'm gonna do something great today. I'm gonna accomplish something. I'm gonna leave tired, and sometimes worse off tired. I'm gonna be sore and stuff, but I'm gonna leave out feeling I left everything out and I did the best I could, and I'm gonna come back and do it again tomorrow. And I feel like I'm making a step towards the next goal, towards my goal, or maybe a new goal that I didn't know about. And I'm also at the point now, which is kind of surprising. I didn't think I'd get there, is that I want to go do it again. I'm excited about the next day. So that's kind of just overall, it's just a positive. And yeah.
That's awesome. I love hearing that it's fun, because I think that's so important. And I hear from patients all day long, like when I ask them, what's your current exercise routine? I mean, I would say I'm still shocked how many times I hear I've never liked exercise. I'm just not an exercise person. And I think the fun part is like so super important to sort of shift the perspective on that. What advice would you have for physicians or other health professionals who are already practicing CrossFit or training in the CrossFit methodology themselves, and want to share that with their patients and or family or colleagues?
Don't be afraid to discuss it. Don't be afraid. There are, the gym's going to work with you. And the secret really comes down to like Coach Eddie there, who if I can reach half of his ability, I'll consider a success. I mean, the dude is awesome. He's just a great coach. He really cares about me, and Coach Jody, and Coach Nesh, and our Dr. So all the coaches we have, I think they really play a key part into it. And but having that conversation with your patient and just let them know it's okay, that they steer it towards it. The way it's designed now, from what I didn't see before years back, was there's tiers, and I think you showed it on the slide, is there's ways to modify it to meet you where you are, and then the coaches are not going to push you beyond your limits. They're gonna push you to get to the next level, but you're not going to feel bad about it. You might not be able to do a push-up, for example. You might not be able to pull up, but there's muscles that you can use that get you to that level. And it was exciting to see. Now I'm not able to do a full pull up now on my own, but I'm getting to the point where I'm getting up to my shoulder, and I'm like, okay, this is good. And so then they start working on those muscles to get you to that next level. I think that from the patient level, sometimes we go into doctor's offices and we kind of, yeah, we'll do it. And I think my own personal, I think sometimes we need a little bit of kick in the butt and saying, hey, you need to get in there. And I've never done a program that's adjusted me this quickly and made me feel better about myself. And as far as, fixing it, because, diets and all that kind of stuff, I don't know, it's not sound fun to me, but just having that conversation saying, hey, you got to try it, just try it. And I think that's what when I was invited to it, is that said, hey, just come for one, just come for one. And then I was like, okay, that's not bad. And they said, well, try this foundation. We teach you the skills, foundation skills. And I was like, okay, well, all right, well, I'll go to a lesson. And I did 3, and the 3 went really well. And next thing you know, I did like you said, the what do you call it, nutrition. And now I'm like, well, sign me up for 5. Now it's like I'm pushing myself. When I was on vacation for a week and a half, 2 weeks, I worked out every day and was sending messages.
Yeah.
You saying I did my workout.
Rest on the beach now.
I felt like I was like let my crew behind. The people that I work out with, I was like, I am working out. So just don't be afraid to talk about it. It does work, absolutely. I think there's maybe some patients that have a negative feel of CrossFit, just going to be beating you up, and I think that's what it was. And but no, I think it's there too. What I learned about it is that you learn about your and what I've gathered from it is the cardio. It all works in your core, towards your core. And I think totally something's wrong.
It's all secretly cardio.
the cardio, it works on your gymnastic side of it. It works on the weight training, and all of it goes to your core. And the core is where a lot of us are, as patients, we're not always happy with, And so I don't know, I'm rambling a little bit, but that's me.
That's awesome. I have other questions. I don't know, Jen or Tom, if you guys wanted to sort of steer the direction, questions. And then I have a couple things I wanted Eddie to share as well.
I put a couple of questions into the chat, Shweta. Mr. Ribby, I'm curious, how many weeks or months was it into the journey before you were excited about going back? Because we talk a lot about in establishing kind of habits and fitness routines, about that process of establishing the habit and getting over the initial inertia, and then getting to the point to where you actually start to feel bad if you don't go, and you're getting really excited to go. Do you have a recollection of kind of when that started to feel that way for you and you were excited to go back?
I went to thinking, well, I'll go do it. Okay. All right. I know I need to do it. 2, after that first time, I was like, the people who were there were really cool. They were really nice. Here's the thing about CrossFit is, for example, I work out. I see some of the coaches go in there for their workouts too, and I see Eddie, and he's doing all this cool stuff. But even he struggles. He has times where he's lifting a ton of pounds that I can imagine, but he's going. In other words, everybody has a personal challenge, but it's not like, oh, you look at that, you're weak. No, it's like we're all working through it. And the neat thing about it, it's an environment where we're all cheering each other on. And I know when I first came in, people were like, oh my gosh, this, I never felt judged. I was thinking I was gonna be judged, but they were all like, yeah, okay. Hey, you did 10 push-ups today. That's awesome. That's really good. Now, and Eddie can do 100 push-ups, but he's still looking at going, well, I'm putting weights on my back and, and all that kind of stuff, but he's still challenging. So I think it pushes you. So to answer your question, after that first lesson, really, I was hooked.
Oh, that's
and as far as where I got to where I start feeling guilty about doing it, when I went on my vacation.
Well, I would say that part of that was because it was in the middle of our challenge and it was like a team-based challenge. And I think, again, that's that's a really fun part of what we do is like, especially as, I mean, if you're like me and never did team sports, you never really had that feeling of like accountability to your team. Or if you did do team sports and it was a really long time ago, you sort of missed that. And so everybody really likes this sort of team aspect, and I think it's motivating for everyone. I like this question from Nicole Coin. It says, what was the deciding factor for you to join? The doctor telling you, the research, etc.?
Doctor.
Sounds like physician
Yeah.
promotion.
Yeah, that's what I'm saying. Don't be afraid. Don't be afraid. In fact, she was going like, "Oh, let me see your phone. Here, I can help you sign up."
To everyone.
Yeah,
Here's
and
how
she's
you
like,
sign
started
up.
filling this. Wait a minute, I just signed up. No, and all kidding aside, it was also something I part of my thing is I was, I'm hitting that 52 mark. I look at stairs and I was going, I really don't want to climb those stairs. I'm 52. I'm seeing people that are younger or older that are like rocking this stuff out. And I started thinking, why am I afraid of that? Why am I? And it kind of hit me at the same time I'm being invited to go. And that's what called me.
That's amazing. I mean, this highlights a really important point that I think all of us as healthcare providers working in this space need to take to heart, is that first class and first experience can be make or break, right? Because if somebody goes in and they don't have an amazing experience, that can be it. And so for all of us, I mean, this is a really important, talking to myself too, like making sure that we have the pieces in place so that we are 100% sure that when that patient gets referred to the affiliate, that experience is going to be amazing and blow their mind. That's what's going to make it successful. That's really, really helpful, Mr. Rippey. Thank you for sharing that.
Wow.
Yeah, and I would just add to that. So and I'll have Eddie talk about that a little bit as well. So we've referred several people to the affiliate over the, I mean, especially over the last 3 months as we've been building out our program, but prior to that as well. And again, for me, it's really a unique position because I'm a primary care physician. So I see my patients back. And, I think most physicians, unless you're just doing some like really one-off type of service, are going to be seeing the patient back. So the nice thing is, even if they didn't have that like home run out of the ballpark experience on that very first time they came to the gym, you have the opportunity to talk to them about it again, because they're still going to be coming to see you in the office. And I've had a patient who I referred, and she got a migraine the day of the class. And so she still came, but it was not like a great experience. But I still feel like that little bug is there in her head that she might want to try it again in the future. So I think, as we think about growing the affiliates and these relationships, even if you're not necessarily involved in coaching in your affiliate, having those relationships with the people who do coach and the affiliate owner can really help to sort of not just make it like, only that one time, like to help give other opportunities for people to experience what happens in the gym every day. So,
So I'm gonna interject just real quick. So Shweta, if you don't mind, maybe talking a little bit about your program that you guys
Yeah.
have worked to develop in your clinic, just to kind of highlight what I understand to be kind of like a middle step between like the straight referral into the affiliate. And I'll let you do that, and then I have a follow-up question potentially.
Okay. Perfect. I'm definitely going to do that. I did want Eddie to talk a little bit though about what it's been like for him, because as Dinesh mentioned, he was been in the CrossFit space for a really long time, owned a box in Chile where he's from, competed at high levels in the games, the regionals, also coached at a gym that was maybe a little bit more competition oriented in Miami before he moved to Atlanta. So I just wanted him to talk a little bit about what it's like on the coaching side, having people come into the affiliate who've either never done CrossFit or maybe didn't have the greatest experience the first time that they tried it.
So guys, happy to be here and share time with you. For me, it's a really new experience. My background is for 14 years. I am regional athlete, regional really old school, OG. I competed in Wodapalooza a few years ago, and my last work was in Peak 360, like a high-level training athlete with Noah Olsen or this kind of athlete. And now it's another kind of straight, like a work with normal people, or the 99% of the population now is not the 1%. And for me, it's different, but I think we can help a lot to the people. So I think for us, like coaches, and you guys, like a physician or doctors, it's important our relationship, how we can communicate, how we can improve every new patient, or in this case, with our break, because the people feel scared sometimes to going inside in the CrossFit gym. It's really like a huge amount of people who feel scared or fear for going inside to the CrossFit gym. So in this project, it's different because all the facilities and all the physician, all the familiar things are in the same place. So we have the doctor in the same place, and now the wellness center with me. So I think it's the new era, or maybe the new age, for how we can work between physician and coaches. So if everyone can improve the same kind of wave or style of training, I think we be already a huge success. Definitely it's a different way. And another thing for me is try to now share time with all my patients are athletes in the same time. So training with there, wearing the same workout with there. This is really important for me.
Yeah, it's really special. It's really, I mean, I feel like it's really kind of on the medical side brought a lot of enthusiasm from our staff, and within the practice, it's like rejuvenating. So that's been really fun and exciting as well. So yes, let me share a little bit more. Okay, can you see the slides again? Yes. Okay. Okay, so yeah, I don't have too much time, but we took a small space in one of our clinics, which is sort of the way our system is set up is a multi-specialty group, and we have several locations. And so we do have one clinic that's sort of the hub where a lot of our other ancillary services are. And so as you can see on this photo on the left, we just took a regular exam room and renovated a little bit with paint and things like that, and then bought a bunch of stuff on Amazon and ordered some signs. And again, this is where having Dinesh and Eddie and myself, who sort of really understand and know the methodology, it's like you really don't need a lot of stuff. You don't need a lot of stuff. It's not about the stuff. That's not what CrossFit is for the new athlete or the kind of regular person like me and my patients. So this was sort of the beginning of our renovation. And then if you look on the right side, it's sort of a montage, but this is kind of where we are now. We just have a couple of boxes, dumbbells, a whiteboard, kettlebells, mats. We have a bunch of bands on the other side, and that's really all that we're starting with. And these are some of our patients. This is Roger working with a PVC. This is Sharon just doing some body weight stuff, playing stuff. And we actually saw her this morning, and she used to be, both of these patients used to be in the military. There was a point in their lives when they were training quite a bit. Physical activity was really part of their daily routine. And then they got out of the military and it sort of just fell by the wayside. And Sharon was telling us about how she went whitewater rafting, and she picked the highest rapids route, and it really was a great workout for her upper body being on the rapids. And I think she told Eddie after the session today, like, just coming here once a week has sort of motivated her to get back into that degree of physical activity. So
we start only for once a week, because I think the first step is it takes slowly. So once a week is something better than nothing, and they feel the confidence. And little by little, they start going one more time, 30 minutes, 1 hour. This is the key. It's like build something, because it's a different way now. It's no people feed, it's under feed, it's really with so many troubles. But the key for every coach, I think, is build all the people comfortable and close and motivate and try to use the same movements. I use the same program with CrossFit, warm up, strength, skill, and all the kind of not fundamental movement, but in a different way.
And then this is a couple, they're, in their 60s, kids have just gone off to college and just really looking for a lifestyle change. And so they've been coming in once a week, and they're also working with Nicole, who's our dietitian. And so, this is really the very basic pieces of our initial program. We have Eddie, we have Nicole, we have me giving everyone my cell phone to make them sign up for classes. But I mean, I think it's the people, right? So it's the people and the enthusiasm. And I think it's also just really exciting for people to hear someone say to them and really believe, like, yes, you can be a CrossFitter. There's so much out there saying, like, it's dangerous, don't do it, it's not for you, it's too hard, it's like Mr. Rupi said, it's going to beat you up. And then when they hear someone say it in a different way, and then they sort of see all this and the words CrossFit, and I think it's really exciting and fun for the patients as well.
This is amazing. I mean, what a beautiful illustration of bridging the gap and decreasing the barrier of entry, right, for your patient population, to give them a taste of the experience and make that, hopefully that transition to the affiliate that much smoother and that much exciting. So it's just really, really cool. Jen, any other questions we want to highlight before we kind of wrap up, or anything else you guys wanted to finish or share with the group?
I had just wanted to know if you ever use your room for team or staff activities or like movement breaks or anything. Just having access to that in your practice is super cool. So I didn't know if you use that for, team building.
Yeah, we did one WOD with my kids, but so that is actually something we're thinking about doing. We've actually had one staff member that has driven 40 minutes just to come, because she's been working with Eddie and Shweta. So our hope is once things get going, we can use that as a space for our staff to actually become more physically active. I wanted to make one quick point that will kind of tie in a lot of the comments that everyone's made. And one of the privileges of being a primary care doctor, I'm not, so one of the privileges of being a primary care doctor is you get to see patients across their journey. Sometimes they're not in the right place or the right time for a change, but with every interaction, there's an opportunity when the time is right. And when you have someone like Shweta and a lot of the other primary care doctors who are kind of getting a little bit tired of just pill pushing and know that there is a way to have more long-term benefit, those are great intermediaries to work with individuals like Eddie. And the benefit of someone who has the skills of Eddie is that he has seen the top 1% and then the bottom 1%. And he has that passion that attracts people. And this comes back to the point that Jen was making is, how do you transition this? And I think the way we transition it is just one patient at a time. And when they're in the right place and they realize that CrossFit, for lack of a better term, is an adult PE class where you actually don't get judged, it's very, very comfortable. And then the final thing is that because CrossFit is infinitely scalable, everyone can be involved. It doesn't have to be the most fit people. I think once we get past that barrier, it becomes much more effective. But the most important thing, I think, is what you mentioned, Tom, at that CrossFit Summit, is that one of the definitions of CrossFit also includes community. And so the more our patients feel they're a part of a community rather than as a 15-minute visit, they have more lasting change.
Yeah.
So I'll leave it at that. Those are my
Yeah, that's beautifully said. Shweta, Eddie, Mr. Rippey, anything you guys want to say before we wrap?
No.
Yeah, I always have something to say.
Mr. Rippey.
Do you have anything to say, Mr. Rupi, before I start joining on?
I appreciate. I'm heading towards my goals, and biggest thing is that I'm not having to take the meds, and that was something I wanted to make sure I add is that when you said, hey, you do this, you're not gonna need the meds. Guess what? I'm doing it, and I'm not needing the meds.
That's amazing. Congratulations.
Thank you.
I mean, and that kind of leads right into exactly what I was going to hit on, which is, I mean, I think, again, I feel as a primary care physician, I can only speak for myself, that it's incumbent upon me to tell my patients this. You know, if they're coming in and they have a new diagnosis of prediabetes or prehypertension, or you know, triglycerides are over the upper limit of normal, and I know they're eating garbage, I mean, it's truly incumbent upon me ethically and morally to tell them that it's because of their lifestyle and not just that they need to take this medication. And, you know, as Dinesh said, people are in different stages of their life and understanding. And, you know, I always say to them, you have options. Definitely, if you're not ready to make a lifestyle change, I don't want your sugars to be in the 200s. I will prescribe this medicine and make sure that we keep it in a range that's going to reduce your risk of future complications. But one of the ways that I really found to help people understand, and this actually came out of the obesity medicine work that we do, is that I tell people, you know, this medicine, it doesn't change your underlying physiology. What it does is it treats this number, it treats this level, but it's not solving the underlying problem. And that's true of the obesity medications, and it's essentially true of all the medications that we prescribe for metabolic health. But this other thing that we're doing that we can show you that you can try, it changes your underlying physiology. And that is going to actually cure you of this condition. And that really resonates with a lot of patients, because I think that there's this kind of conception amongst people who are not in the depths of, you know, the medical understanding that all of us in the CrossFit Medical Society are, that, you know, this medicine is solving my problem. You know, just like I have an infection, I take an antibiotic and now my infection is cured. And so I think, like, again, reframing it and helping them understand has been, you know, it's been huge in terms of people being more receptive to actually work on lifestyle change. And then the other thing is just really shifting away from weight and losing weight and getting skinny to like getting healthy and body recomposition and strength, all the things that sort of we hit on in the CrossFit Health Conference as well. So I could talk about this for another 4 hours, but I won't.
Amazing. Well, this was just fantastic. I want to thank you all for being so generous with your time, Mr. Rippey, Eddie, Shweta, Dinesh, spending it with us today, and everybody who took the time to hang with us here for the hour. We have a lot to think about. I think you really highlighted a lot of important concepts for us to take away. And one, I think that we can all start working on right now is that if we're using CrossFit as a prescription for our patients, our clients, that we really work to establish a relationship with the affiliate and the coaches to make that experience as enjoyable and as seamless as possible for the people that we're sending there to start. And I think that what you have done by creating this intermediary step within your clinic to make people comfortable with people that they're already comfortable with, and bringing Eddie from the affiliate to that space to work with people, is just an amazing example of how to do that in a different way. Everybody watch for the emails that will come out with the questionnaires that you need to fill out from CrossFit and from us to get credit for the hour. And thank you so much for being here. And then Jen, do you have anything else before we wrap up? No, we can close it. Okay. Stay tuned next month. We got a really amazing month of content coming up in August, and I really hope to see most of, if not all of you, at the games. We got a ton of stuff going on with the Medical Society, so please stay up to date on that and come out and participate and hang out. We want to see everybody in person. So thanks so much, everybody. Have a great evening.
Thanks, everyone.
Thank you.